Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. This episode deals with mental health in children and teens and how that affects the parents and the family as a unit. May is Mental Health Awareness Month, and Connecticut Paid Leave covers mental health issues. If it fits the criteria of a serious health condition, it must include incapacitation and continuing treatment with a healthcare provider. Chronic mental health conditions are also covered under Connecticut Paid Leave. 1 in 5 children suffers from a serious mental disorder. That's 1 in 5. And this morning, I read this in the Stamford Advocate that according to the Connecticut School Health Survey conducted in 2021 and just released this month by the Department of Public Health, more than a third of Connecticut high school students reported having felt sad or helpless, while more than a quarter report that their mental health was not good most or all of the time. And about 1 in 7 said they had seriously considered suicide. Only 22% of the students said they can often or always get the help they need, the lowest figure on record. And these findings reinforce what advocates have called a children's mental health crisis in Connecticut and elsewhere. I have 2 fantastic guests. Shannon Oscan is our parent with lived experience as a mom with a child who struggles with mental health issues and works for Favor Inc., a nonprofit that assists families that have mental health needs and advocacy. Thank you so much for being here.
Thank you for having me.
And of course, we have Dr. Frank Gregory, the administrator of the Connecticut Children's Behavioral Health Community Services System, which is a tongue twister, and I'm glad I got through all that. Thank you for being here. And just tell me what your takeaway was from that health survey that was released.
Well, I think it really underscores what we've known, which is too many of our kids have been struggling and suffering. And so it also really underscores the continued call to action that we need to respond, and we need to do what we can to have resources in place and support for kids and families as they continue to try to bounce back from the struggles that we've all been through these last few years.
Yeah, the pandemic certainly has been chaotic for everybody, I think. And Shannon, what are your thoughts and takeaways from that?
Similar to the doctor, I feel like that the pandemic has highlighted a lot of the mental health needs that were already out there. I feel like the distractions of school and other things were no longer there, so it made the mental health piece of it stand out more to the parent and the family that their child was experiencing. I think it had always been there. It was just we were able to see it a little more clearly when we were forced with that piece where we had to stay at home with our children. We kind of saw their mental health, and then we also saw it exacerbate over that time.
What are some of the most common types of mental conditions that you are seeing and treating in kids and teenagers?
Well, it varies across ages, and it looks different depending upon the age of the youth. But I would say that a lot of anxiety, a lot of depression, many youth are presenting at emergency departments, reporting thoughts of suicidality. And so in many ways, you could look at each of those as reactions to intense stressors. I think that, again, not that we lay everything at the feet of the pandemic, but I think we don't want to underestimate the degree to which the pandemic was sort of a pervasive and collective trauma that we all experienced.
Yeah.
And so that really had an impact. And I think that notion of trauma, adverse experiences are something that we pay a lot of attention to with kids, because kids grow, kids learn, kids are, that's what they're best at. And it's when things sort of in their experience intrude on their ability to do that, right? And get in the way of their ability to bounce back and be resilient. that's when trouble develops. And so those are those things that we want to pay attention to and respond to in our kids.
So like mood disorders and things of that nature, and PTSD, obviously, from the pandemic. I think we all have a little PTSD from the pandemic.
Mm-hmm.
I mean, I really do. And even though they say everything's back to normal, I mean, do you ever, how do you recover from that? And are kids more resilient than adults?
That is a good question. Are kids more resilient than adults? I ask myself that all the time. So I'm interested to hear the answer on that, because I ask frequently, is it me who's impacted the most by this, or my kids?
Mm-hmm.
I would say kids, by and large, aren't locked into as many patterns as adults may have become. At the same time, adults may have developed more tools to deal with their experience, right? So it's, again, it varies on the kid and the family. But I would say kids, by nature, are very resilient. It's part of that growth and development. And that's what we want to see. It's almost if the visual of, putting your finger on a piece of foam and pushing in. And when you let go, it can bounce back, right? But if you do it in such a way that it's too much, too often, too violent, then the ability to bounce back is impacted.
Can you tell me the difference between challenging behaviors and emotions that are a normal part of growing up and those that are cause for concern for parents?
Well, I think it has to do with that notion of to what extent is it getting in the way, but also to what extent is it worrying you? I mean, parents should trust themselves and listen to themselves. You as a parent are the expert on your family and your child. And so we as professionals, really what we need to do is listen to what it is you're telling us about your experience and help you understand what you're seeing. So it's probably more of a gradation. Certainly there are things that to any extent are, would be very concerning. So things where kids are getting a behavior that's dangerous, where they're putting themselves at risk or hurting other people. The quiet suffering, if you will, that so many kids experience, right? Yes, there's an extent to which that social interactions and social development has challenges built in, and that will cause kids to not feel good. And there's social experiences that contribute to kids being depressed, overwhelmed, anxious. And so we really want to, again, be attuned to our kids and try to help them listen to their own signals and help recognize in themselves when they've sort of crossed over into something that's more worrisome.
I have been in touch with families who have children who have self-harm issues. One of the harder conversations I have to personally have with my child is there anything new? Are there new cuts? Are there new wounds? So I kind of make a visual inventory of where those things are located, and I'll subtly do body checks. I don't want to embarrass my child or make them feel like what they did was wrong. They didn't have the right tools to express how they were feeling in that moment. And I'm hoping with the therapy that my child is getting, and with my support and with the support of every family member that we have, that they're finding different tools and finding other ways to utilize that coping strategy that is negative. Same with the families I work with. If their child is self-injurious, I always let a parent know that it's nothing that you did personally, because I struggled with that myself, blaming me. It's the child wasn't able to find a tool in that moment, and that's what they utilized. It's something that I always keep in my mind throughout the day, periodically, when I'm having contact with that child that does that type of behavior. And I think with the right support system, that typically does alleviate itself on its own. I think the trauma of brother passing 3 years ago is what amplified my child's need to find that outlet to release some of that stress. And I found when I'm working with families, it's generally right after a trauma that this behavior begins. So I tell the parent that there's nothing that we could have probably done different. It's something that we discovered. We deal with it. We handle it in an appropriate way so the child's not shamed. And we kind of find a new tool for that child to utilize. Luckily at Favor, we have access to some things that other organizations may not have access to. We have a behavior incentive that we can utilize for funding to get that child some type of benefit from utilizing their new tool initially so that they continue to use it after they've learned it.
Like they get some kind of reward in what way? Using their phone or doing something?
Exactly. And we have a little bit of we can get like gift cards for like ice cream or iTunes or things like that for the child to initially have that immediate reward, but then later they have that continued reward of having a new tool that they're using instead of using a negative tool. So we're kind of reinforcing the new tool that they're going to utilize instead of utilizing their body for self-harm. And self-harm isn't just putting cuts on your body. It's not showering, not eating, not coming out of your room, not coming out of bed. That's self-harm as well. So when we can get a child, a teenager, a young adult to find a new tool, we want to reinforce that with something so that they know what they're doing is right. And then they gain that longevity of having that tool. I think that when I'm going into a home, for the most part, kids are more open to talking about it now. Mm-hmm. When it's a discussion, they are willing to have the talk for the most part. You know, like I said, we try not to shame or embarrass, but I think that because it has become a little bit more prevalent in society that kiddos are willing to talk about why, how, where they were, what they utilized, so that I think it's a silent cry from them for help, and they're just waiting for someone to see it.
Wow. You certainly have seen a lot. Go ahead, Doctor.
I would agree and pick up on that the ability to be able to talk about it, right, is really key, because sometimes it's something that can be scary to experience and scary as parents to talk about. But some of the resources, particularly in the area of self-harm and self-harm that's in the context of suicidality, right, we want to take that very seriously. And we've developed resources around the state to help people engage in suicide prevention. So one example, there are trainings. We have a statewide suicide advisory board, and there are regional suicide advisory boards, and they provide supports and trainings to people. One of the models they use, it's QPR: question, persuade, refer. Question, talk about it, ask about it, and then persuade, work with someone to help them believe that, okay, it can get better. This is worth trying to do something about, and refer. How do you connect them to the resources they need? So there are some concrete things and some resources we've tried to build around the state that can really be tools to help respond to what we know is, unfortunately, a growing phenomenon.
Yeah, 1 in 7. I'm not a parent. So, but I can only imagine the fear when you hear your child saying, I don't want to be here. And how do you respond to that? I mean, that has got to be the scariest thing.
And sometimes they don't even say they don't want to be here. Their actions kind of show it. My child wouldn't even get out of bed to shower, eat, or take any medications. My child has a thyroid condition and has to take daily medications. And if that medication is not taken, it can lead to more serious complications. So sometimes they don't even verbalize it. And unfortunately, when I saw my child in that situation, it was time for me as a parent to intervene. As hard as it was for me to call the police and have them come out and take my child from the home and essentially put my child inpatient for treatment, it was what was best in the moment. The signs are there, and sometimes we just have to look for them.
Yeah, sometimes parents miss the signs, right? Or, the kids don't show it.
You feel guilt, though, when you have to. I had to sit in my car outside and make that tough call, and it was very heart-wrenching for me to do. I was on the phone for 15 minutes with the dispatcher while the police were on their way and the ambulance came. But I have to say, the Connecticut State Police Troopy, they handled it like a trooper. They really did. They did not go in there and shame my child. They just said, okay, you need to get up and put some clothes on and come out and sit with us. We need to talk for a minute. And my child came out. We sat together, and the cop made it clear that the ambulance was coming, but not in an aggressive manner at all.
And so how did your child relate to that? Was he open to that?
Absolutely. I think the way that I had done it, where I wasn't in the room saying, you know what, I'm having the police come get you right now. Like, I did none of that. I just said, okay, so you're not going to go to school today? Nope. I said, okay, well, I'm going to have to think about how I'm going to handle this. And it may be in a way that you're not going to like, but just know that it's because I love you. And I went and I got a coffee and I came back to my house, and that's when I sat in my car. I was drinking my coffee. I called the state police and they came and they intervened, and it worked out marvelous for my child. That's not going to be for every family, but particularly for mine, that's ultimately what we had to do. Look for those signs.
You really want to communicate to the child, you're not in this alone, and the parent needs to know that too. And so how do we really make that happen? How do we put resources so that parents and kids aren't going through this alone? And those are some of the things we should highlight as well, so people can know what some of the resources are. We know that a mobile crisis in Connecticut, we have mobile crisis resources. So 988, families may have heard of. It's a nationwide, it was a suicide helpline. It's been expanded for crisis response, and right now 988 is available throughout Connecticut, as well as 211. 211 has been a number in Connecticut available for some time. And so no wrong door, calling 988 or 211 can access, among other things, youth mobile crisis. And so for families and kids having a mental health crisis, we now, 24 hours a day, 7 days a week, have a program where a clinician can respond to your home and help support you, and on average in under 45 minutes. We've also developed some programs as part of that crisis response continuum. We're calling them urgent crisis centers, a few centers around the state where families and children can go as an alternative to emergency department. For kids who need to be in the emergency room, that's where it's important they go. But many kids were ending up in an emergency room because there was nothing else. We want to create other options and build out the system. So those are coming online. So really it's a matter of how do we put tools in the hands of parents and their kids as they work through these really important issues.
With mental health issues, sometimes kids self-medicate with alcohol or drugs, or, as we know, prescription drugs are really big right now. What do you do when you have a child who is struggling mentally and then has also got an addiction issue as well?
I'll defer to Shannon from the parent perspective. From a treatment perspective, there are treatment interventions that are particularly aimed at working with youth and young adults or adults with substance use difficulties. I think with kids, again, that spectrum, for many kids, there's, always been this sort of experimentation. For others, as you've said, there's a self-medication. I think with kids, in a lot of things, one of it is they may become involved in things that are dangerous in ways they don't know or don't appreciate. And so what might be their intent is just to sort of go along with the crowd or, try something out. We know increasingly there are many risks that really make that something that can be quite dangerous. So there are, though, it is important to not hide it. There are resources, there are people who can respond, and we want to make sure that we can help connect families and their kids to those people.
And from a parent perspective on that, we do get parents whose children are finding ways to cope, and they do that route of utilizing marijuana or drinking. The key I feel like is giving them all of the information, the children, giving them knowledge on what could happen, what's the risk, essentially harm reduction. If you have the information and you still continue to utilize that, we'll refer to agencies to get the parent in to discuss what options are available. There's resources in the communities. There's the Connection where you can go if you have a substance abuse and mental health need, and they're wonderful. They sometimes have same day appointments. So if your child one day is like, okay, I need help, it's definitely a great tool to utilize the Connection. If it's a right now I need help, you may sit for a couple of hours to see somebody, but in the end, you're going to get the benefit of your child having someone who can help from a professional standpoint.
Yeah, I would imagine it would be really difficult seeing if your kid is addicted to some kind of drug and then fentanyl is brought into it? Because we all know that fentanyl is a huge drug right now that is out there, and they don't know they're utilizing it.
Usually I share my own personal experience with what happened with my brother. I will share that he was a very avid marijuana smoker, and you can find fentanyl in marijuana, and it only takes that one time. And that's all it took, is one time of fentanyl ingestion. And unfortunately, you can have a very bad outcome.
And did that also affect your kids when that happened?
Absolutely. They started utilizing, now that, marijuana is recreationally legal, they started utilizing the actual dispensaries versus getting whatever they could on the street. Not that I ever think that they should ever have to medicate with marijuana to feel able to live day by day. We've talked about that harm reduction. And if they're not willing to find an alternative method, I have a child that's 22 and he has bipolar schizophrenia, and he's very dysregulated at times. So I feel like giving him safer alternatives versus utilizing what's on the street is better for him. But I also, with my younger children, you see what happened. You see what happened to our family, our loved ones. You make a mental note of that things in the world aren't the same. They change so vastly that you have to monitor society, kind of navigate it differently now.
And when that happened to your brother, did you go into therapy or did you just try to control it? I know that you deal with this in your job. You know what to do, but how did you try to repair the family? Because that's devastating. That's just so devastating for you, too.
Absolutely. We have done some sessions with therapists around the trauma. Each of my children have different mental health professionals. So depending on what level of trauma that particular child is in, we will have discussions or sessions to see where they're at mentally. How is this affecting them? Is it something that they want to talk about? Is it something that they don't want to talk about because they're afraid of what can happen to them if they ever were to obtain fentanyl in the streets? So we kind of base it on the level of trauma, who we're going to see, and how we're going to address it. It affected my 22-year-old very differently than it did my 14-year-old. So he was very close to his uncle. So it definitely made him see things very differently when it came to the trauma that can be left with the residual effect of fentanyl.
When you hear your story, I think of you as a caregiver. Who takes care of you, Shannon?
Luckily, I do see a therapist every other Saturday at UCFS. She's amazing. And she said to me, "What's your goal?" I said, "My goal is to come to therapy to discuss everything and for you to make me accountable for doing something for me." And she kind of laughed. And I said, I need that person to be like, "So what are you doing?" I need that check-in. And that's what my therapist does. She says every other Saturday, "Okay, what are you doing this weekend for you?" Last week I got my nails done. So that was my time away from the home. But that's what I told her. My treatment plan is for my therapist to make me accountable for self-care.
And I think that that's super important. And doctor, do you find too that parents sometimes forget about themselves when their children are in distress?
They do. And as Shannon said, it really is important to keep that in mind. It's like on the airplane when they say, if the oxygen comes down, you need to put on your own mask before you can help somebody else. And I think it really is true that we have to take care of ourselves, because we also know our kids look to us as parents for how to handle things. They look to us to see if we are okay, does that mean things are okay, right? And so the more we can do to help respond to our own needs, the more we'll have in the tank, not only to respond to their needs, but the more things will be better. And so it really is important that we take care of ourselves as well.
And what about marginalized communities, the Black and Brown communities? Do they have access to good mental health care treatment? And do you think maybe telehealth helped those communities?
Well, a couple of things. We do have an extensive array of providers across the state in both urban and suburban areas. That said, though, I think we can't minimize the extent to which systemic injustice, racism has impacted families and our service system, impacted access to care, impacted the experience of people intergenerationally in terms of their exposure to violence or insecurity, economic insecurity, housing insecurity, food insecurity, etc. So I certainly wouldn't minimize those very real and, as I said, systemic concerns. And even when you mentioned, telehealth or during the pandemic, when schools went to virtual learning, there certainly were divisions as far as, who had access to what technology in a laptop or an iPhone or broadband. And so those are very real systemic concerns that we have to continue to fight against.
And Shannon, do you face the same problem, inequities with mental health?
The families that I serve, yes. The Black and brown families, when they are in the educational setting, it is up to the school to keep a very good eye on their students to see if it's a mental health crisis or not. And I have found in a couple of the school districts that I work with, their Black and brown students were looked at as behavioral problems and not a mental health crisis. Mm-hmm. I've had to file state complaints for a couple of different districts who were under-diagnosing Black and brown students. I don't know if it's because it was a more predominantly white area and they just were so used to servicing white students that they forgot about their Black and brown, but I did have to file a complaint with the Office of Civil Rights, the Office of the Child Advocate, and with the State Department of Education for one particular student who they sent over 108 pages of discipline. And I'm looking at this going, this is a child who was struggling, a young man who was struggling, and no one saw that this was a mental health crisis.
And that's where sometimes they go to juvenile detention. And that's where they end up, because if it is behavioral, they can say that they are violent.
That's exactly what happened with this young man. He had some criminal charges that were pressed against him once he was 18, and this transpired inside the school. They had him arrested and taken out. And when I went to help him through the court process, I explained that this is a mental health crisis. The school failed to identify that. They did do corrective action and they did go back and do a full neuropsych, and it was determined he had suffered recent PTSD. He was assaulted by 5 white students and still was not seen as a mental health crisis. So there was a lot of complex issues behind the scene. And it's not just his family alone. There's other families that this is happening to. And when I walk in, I'm like, are you really serious? This is a mental health issue, not a behavior issue.
Well, I'm glad that you're advocating on their behalf. That's really important, Shannon. It really is.
Absolutely.
And this is sort of where Connecticut paid leave can come in, right? Like, many people may not realize that mental health issues can be a serious health condition and can allow for up to 12 weeks of income replacement under Connecticut paid leave. So if your child or you need treatment for mental health issues, it has to include the incapacitation and continuing treatment from a mental health professional. But caregiver leave is super important for parents so they can take time away from work to deal with their child's mental health issues and not worry about income. And that's one of the nicest things about Connecticut paid leave. And I know, Shannon, you've actually used it, but not in our state yet. You used it in Rhode Island.
Yes, I did have that luxury while in Rhode Island when the pandemic first began. They laid off the parents that had children first because our kids couldn't go to school or go to daycare. So they were very good about releasing parents first. And they did tell us that because this is due to a significant mental health and mental health students weren't going to be receiving the support that they were getting in school, that we could utilize the Rhode Island paid leave for that purpose. And those parents who their children didn't have any mental health issue, they also were able to utilize it from a different perspective. But for myself, I have 3 disabled children. My 22-year-old has bipolar schizophrenia. My 17-year-old is autism spectrum disorder level 2, and my 14-year-old is autism spectrum disorder level 1. They could not be left unsupervised. And for the schizophrenia piece of it, my son was afraid that he was going to have something happen to him. Ultimately, it would be his demise. But I was lucky enough to have those 12 weeks to kind of mitigate some of those mental health needs. My 22-year-old is not in my home, so I kind of had to shuffle between two different households to maintain mental health, but that Rhode Island paid leave allowed me to do that.
You have people who've utilized Connecticut paid leave as well.
Absolutely. I received a case from a parent in Waterford, Connecticut, whose child was discharged from a program he was put into because they could no longer meet his mental health needs. This parent had to now navigate and find a new support system for her child. So she was able to utilize the Connecticut paid leave. And I remember her being so appreciative that we had it available to her. She said, I don't know what I would have done without Connecticut paid leave. I was offering her like referrals and resources to food banks and trying to find her other things. And she said, fortunately for me, I'm not in need of additional services because I have the Connecticut paid leave. And I told her, at any time you need other resources, let me know. I can definitely look. And she was beyond thankful that that was available to her.
And see, that is what we'd love to hear, is that someone is using the program for what it's here for. And doctor, how significant is it for parents and caregivers to have these services available to them?
Very. We know there certainly have been too many instances where parents have felt caught right between being able to take care of their kids, being able to go to the appointments they need, and feeling pressure from work that they'll get in trouble or they really can't weather the economic impact of taking time off. And so it really does put parents in a bind. And as we've been talking about, the issues of stressors and adding to stressors, right, just can make things worse. And how do we help parents be able to take care of themselves as they take care of their kids? How do we help people be able to make connections? Paid family leave can certainly is in the service of all the things we've been talking about that we know can be helpful to parents as they tend to their kids and their families.
Right. So you don't want to worry about like the stressor of money. That's like the biggest stressor for everybody, right? Really is money, and then taking time to help your child. There's no choice in what you're going to do. You're going to take care of your child. And it's just nice that this is here. And
certainly these stories were more frequent before the onset of this benefit, but there certainly, have been parents who have said, either I can't do what I need to do because I am afraid I'll get fired, or in fact, who have lost jobs because they needed to respond to their needs of their kids and their treatment needs. And so it was very real. And so this is an important benefit that can help parents not be in that same bind.
What did you learn, Shannon, through this whole process?
What I learned is mental health is something that we should all put in the forefront and we should take care of first, because I feel like when we started taking care of our mental health in my home, our physical health became less prominent. I find that in my home, the somatic symptoms of mental health were there. We were trying to find ways to deal with the stomach aches, the headaches, the feelings of jitterness that you get with the anxiety when you're extra anxious. My family was seeing those more as physical ailments than a mental health ailment. And I think we learned from the mental health issues through the pandemic that we were really experiencing mental health symptoms, not physical illness symptoms.
Our mind, body, right? It's us. We're one person. And so it's important that we recognize the impact, as Shannon was saying, of of our mental well-being on our physical health, and vice versa, and that we tend to it. And the other thing, when we talked about what we've learned from the pandemic, I think it was not only that anxiety, mental health issues were prevalent, but I think also of necessity, we all had the experience of it's okay to be able to say, I can't do this alone and I need some help, and to reach out. And so I think that's really an important piece of this, is that we continue to not only encourage people to be able to do that, at the same time that we ensure that we continue to create those resources that are there for them to reach out to.
Absolutely. It's okay to not be okay. It is okay to have a mental health struggle and to get help for it. My biggest thing when I walk into a home is letting a family know that they are where they need to be right now, and they're going to get over it and get through it and find some solutions that will work for their family. But that's the first thing I say to a family when I walk in. It's okay to not be okay.
And is that the advice you would give another parent who realizes their kid may need some help?
Absolutely. It's okay for you to be feeling the way that you're feeling. It's okay for you to feel like you're alone in that moment. Going through those emotions are helping you build what your child is going to need to sustain in the long run. They're seeing you work through your own anxiety and your own struggle, and they're learning from you. I'd like that my children are present at times when I'm sad or hurt or upset, because they're seeing me naturally navigate a real emotion and a real mental health moment.
I would say listen to yourself, right? Pay attention to your concerns. Know that you can reach out, that it's okay to need help. I would also say, but again, trust yourself. Know that you're doing the best you can. That and your child is fortunate that you're there with them and for them, and give yourself credit. Give yourself some slack. Cut yourself some slack, right? And if you do have worries or things that you feel you and your child need, continue to ask. Don't be turned away. And it gets back to listen to yourself. You're the expert on you and your child. And so the rest of us need to listen to that and respect it.
And do you feel your experience as a parent with children with mental illness, it has helped you with what you do in your career, which is helping other families?
Absolutely. When you walk into a family's home and they know that you have children who have similar struggles, you can see their body just relax and they're like, okay, this is somebody who understands.
No, I do think it's important that we, in the service system, remember that we're all in this together. And even in today's conversation, it really is humbling and validating to hear Shannon and her story. And so I really am grateful for the opportunity to be part of this conversation.
Well, thank you both for being so open and honest. And Shannon, your story is really amazing. One of resilience as a parent, for sure. And I really think this podcast, I really hope this will help another parent navigate a little easier. So thank you for being on this podcast. I really appreciate you.
Thank you for the opportunity. And thank you for hosting this conversation.
Absolutely. I think this conversation will help a lot of the families who are not sure of where to go, what to do, and how to find that very essential tool when you're navigating that Connecticut paid leave to help you find where your child or yourself may need to be for your mental health stability.
Well, thank you so much. You're not alone. Help is available if you're under 18 and experiencing difficult thoughts, 211 or 988. And for more information or to apply for benefits, go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.